Kani kedai ke All India Radio Shillong, paralog nong sngap mentangin wan lam syapi ki kubor bakerpang hakabaya day bedu COVID-19. Katanat ka kot ka khia ka sarkar kemi kala pentip baki dan lai pusa hajar sispa khandai ngut ki nongpang ki balakot na ka jingpang COVID-19 pat ka jingdon jong ki nongpang ki balakot no hakari ki lepoi syaka lai punyo 0.3%. Hakini ki arpusa kanta baladem lai hajar khandai spa san pun ngut ki nongpang ki balakot bat kinong pang thamai ki basakta ha COVID-19 ki long sa hajar khandai spa san punyongun hakawai pakalyang ka jingdon jong baro ki balayo ekani ka jingpang hakari kala kiu sha ka khandai po hajar khandai spa ar punyongun kila don shi spa ar pongut kinong pang ki balaklat no na ka COVID-19 hakini ki ar pusaw kanta baladem bat habaken ki lumlang ka jingyap brio ka lengkari kala kiu sha ka ar hajar praspa nyupu arngun naki praspa nyupu laingut kinong Meghalaya ki balawan pai sha naka jala Tamil Nadu lalap bakat arngut naki kila syakta ka jingpang COVID-19 lingba ka jing examine da kitiar rapid diagnostic test kit henden kasngi nyongut kidai na East Khasi Hills saungut na tura bat iway na Ribhoy district hadien bala pendap ya ka jing examine lapha no ikitay marmar sa ki quarantine center jongki district jongki ya ki sample jongki te ki khat arngut lapha no sa PCR test hane Grims Shillong bat Shatura Civil Hospital Katkum ka kaipot baladem bakitei ki saungut na po tura bat iway na Ribhoy district kimsham la syakta ha katay ka jingpang. Kat baki kaipot jong ki nyongut ki bana East Khasi Hills district on sapentip menta kasngi ong usembot menteri rangba ka jala uba presdun tensong. Kajala Assam kala nangkiu ka jingdon jong kinongpang novel coronavirus ha kaba kiladon biang sa saungut kinongpang thamai ki bala syakta ha katay ka jingpang pat ka jingdon jong baro kinongpang COVID-19 ha Assam kala kiu syaki khandai pusan ngun layathu menteri katanat ka kot ka khia ka jalau Himanta Biswa Sarma next ngi nakiti ki saungut kinongpang bathamai arngut kidai na Guwahati iway na Sonitpur bat iway na Sivasagar district usarma ulo ongba yakitay kinongpang la lejbu no yaki syaki hospital henne ka stem Arngut naki labu ha Mahendra Mohan Chaudhary Hospital Guwahati bat iway ha Tezpur Medical College and Hospital bat ya iway pat ha Jorhat Medical College and Hospital Naki kendai pusan ngut ki balayo ka jingpang COVID-19 ha ka jala san pongut ki dei ki badangdan ya ka jingpang saphuai ngut ki balakon arngut ki balayap bat arngut ki balami na ka jala baro ki sampel ki balayo lum ha ka jala ki long lai phuai hajar arspa anyo punreu teli ha ka ba ka jinglap kalong kendai pusan teli ki balong positive bat arpu prajar lai spa lai pu ar teli ki balong negative ne bom don jingpang bat ki don ru ki kaipot ki bompat yo bat ki badang ap hadu menta hadin ka jinglap ya ka jingyo pang COVID-19 jong ki saungut ha kani katayo ha ka jilla Manipur ka state COVID-19 consultative committee kalarai banang penklan shushu ikilat jingeda hapo ka jilla ha ka jingelang bala penya do menteri rangba ka jilla UN Biren Singh layakren halor ka jingnang kiu jong ki bayo ka jingpang COVID-19 ha ka jilla ha ka te ka jingelang layakren ru halor ka jing penbet penbyang ka sarkar banwan lam ki nong Manipur ki badang sakut Shabar jilla lembak ki rel ki bala pen khre kerpang Kidikhat jong katay ka komiti kila ajing mut banang penjela ni ka jing khangdam hapo ka jela banang penbo ni ki jing phong yada ni ki personal protection equipment sya kinong taray ka kot ka khya ki badan haki quarantine center bat kumju ru ban pensange shwa ya ka jing ailat ne aipa si ki breu ka jela ban lit shaw ki bahayeng ki badan Shabar jela da ki kali shimen Ka Indian Council of Medical Research ICMR kala ong baladep ban examine ki khandai phulai hajar lai spa 100% tali ki sampel COVID-19 hakini ki arpusaw kanta baladem baro ki sampel ki baladep examine hapo kari ki long arpu arlak arpunyo hajar 100 spa sapu ar tali hakawai pat kalyang ka ICMR kadang yai peteng banang penbo ni ki jaka shim sampel ban examine takaba ajing menjer na ibor ki laboratory sarkar bat chimedru hadu menta ka ICMR kala ajing mun Jing menjur ya ki lai spa nyo puai teli ki laboratory sarkar bat shi spa san puai teli ki laboratory pelapenya di ki riu shimen bakin wat benya halor ka jingpang COVID-19 paralok nong sngap hilayo sngo mentani ki kubor kerpang hakabaya dei bat u COVID-19 ya kabalawalam syapi da ka regional news unit jongka All India Radio Shillong This is All India Radio Shillong. We now bring to you a special roundup on COVID-19.
Health and Family Welfare Ministry said that a total 34,109 patients have been cured of coronavirus and the recovery rate has reached 37.51% in the country. During the last 24 hours, 3,956 patients have recovered and 4,957 fresh cases of COVID-19 have been reported, taking the total number of cases to 90,927. A total of 120 deaths have been registered in last 24 hours, taking the nationwide toll to 2,872. In Meghalaya, out of the 873 returnees from Tamil Nadu, 12 were tested positive by rapid diagnostic test kits yesterday. 7 of them are from East Khasi Hills, 4 from Tura and 1 from Ribhoi. Immediately they were taken to quarantine centers in their respective districts. Their samples were collected and sent for PCR test at Nigrims, Shillong and Tura Civil Hospital. The results for all 4 from Tura and 1 from Ribhoi have been tested and confirmed negative. The results for the 7 returnees from East Khasi Hills will be available today. The Deputy Chief Minister of Meghalaya, Preston Tinsong, has informed. 4 fresh novel coronavirus cases have been reported in Assam, taking the state's tally to 95, Health Minister Himanta Biswa Sarma said today. Of the new cases, 2 are from Guwahati City and 1 each from Sonitpur and Sivasagar districts. The patients were admitted to hospitals early this morning, he said. 2 patients have been admitted to the Mahendra Mohan Chaudhary Hospital in Guwahati and 1 each in Tezpur Medical College and Hospital and Jorhat Medical College and Hospital, Sarma said. Of the 95 cases, 50 are active and 41 persons have recovered, while 2 have died and 2 have migrated. A total of 31,276 samples have been tested in Assam so far, of which results of 95 have returned positive, while those of 28,332 returned negative, and the remaining reports are awaited. After 4 positive cases of COVID-19 have been detected this week in Manipur, the State COVID-19 Consultative Committee has decided to increase preventive measures. A meeting chaired by Chief Minister Nongthombam Biren Singh discussed the development on increased number of positive cases in the state. The meeting also discussed the ongoing process of evacuation of stranded Manipuris from outside the state through special trains. Members of the committee suggested to increase the lockdown measures, provide additional personal protection equipment to healthcare workers attached to quarantine centers, and discontinuation of issuing permits to stranded Manipuris through private vehicles. Indian Council of Medical Research ICMR has said that a total 93,365 samples of coronavirus were tested in the last 24 hours. The total number of tests reached 22,27,642 in the country. Meanwhile, ICMR is continuously scaling up its testing facilities for COVID-19 by giving approval to government and private laboratories. As of now, 371 government laboratories and 151 private laboratory chains have been given approval to conduct the test for COVID-19. Listeners, that was a special roundup on COVID-19 brought to you by the Regional News Unit of All India Radio, Shillong. Stay tuned for the next program that follows.